my name is Rishma Gatu, and my presentation is on the lifestyle effects on an unusual presentation of syncope. Syncope, also known as fainting, is a brief loss of consciousness due to lack of perfusion to the brain, with characteristic prodromal symptoms. Some causes include orthostatic, vasovagal, or cardiac, as well as lifestyle factors including sleep and marijuana use. We present the case of a 53-year-old Hispanic male with a past medical history of palpitations and chronic marijuana use, as well as disrupted sleep and sleep deprivation from night shift work. He presents to the ED due to multiple episodes of loss of consciousness with no prodromal symptoms. Episodes occurred during micturition and during his night shift. He had no other associated symptoms, and he had no remarkable findings except for some episodes of bradycardia. An interesting finding, however, was that the EPS showed a dual AV node physiology, which may cause him to be prone to AVNRTs and tachycardia. However, he had no accessory pathway, and no AVNRT was inducible with isoproterenol. During his stay, telemetry showed sinus bradycardia with a heart rate of 30s to 50s and an 8-second pause during his sleep. His EKGs, taken just hours apart, differed in results. The first EKG showed an intraventricular conduction block, and 2 hours later it showed sinus bradycardia and an incomplete right bundle branch block. A third EKG, taken the same day, showed resolution of the right bundle branch block. During admission, the bradycardia and right bundle branch block appeared and resolved transiently. After discharge, he was given an implantable loop recorder for monitoring at home. During the next few months, he had 2 6-second pauses with prodromal symptoms, but no loss of consciousness. And follow-up tests were unremarkable. The image here shows sinus brady with incomplete right bundle branch in the EKG. The findings suggest that lifestyle factors may play a role. An interesting finding to pay attention to is that this patient's episode occurred at rest. A possible explanation for this observation is supine vasovagal syncope or sleep syncope, which may be due to the activation of the vasovagal reflex, which then cause gastrointestinal symptoms to precede syncopal episodes. Although this patient didn't have gastrointestinal symptoms, he fainted while urinating, which may be due to increased vagal tone during micturition and after sudden standing. Some studies explain the circadian rhythm's increasing susceptibility to syncope at night, and most people sleep through this vulnerable period without encountering postural stressors. But those who remain awake during the nighttime, such as shift workers like this patient, may be at risk. The onset of these episodes after starting his night shift show a temporal connection. Another factor to consider is the link between marijuana and vasovagal syncope, or sinus pauses due to extreme vagal tone. Many studies illustrate hypervagotonia induced by cannabis. Our patient often smoked shortly before work and would experience loss of consciousness an hour after smoking, also suggesting a possible relationship. In conclusion, it's important to consider lifestyle effects such as sleep and marijuana use on syncope due to decreased cardiac autonomic function. Although the patient could not change his job, he was educated on these possible effects and his episodes decreased afterwards. We hope to call to attention these factors that warrant more research. Thank you.